Hello and welcome to our channel Empower with Knowledge. My name is Rahul and today we'll be discussing CPT or convalescent plasma therapy. Now before we move on, I would request you to please subscribe to our channel and click on the bell icon to receive future updates. Please like the video if you found it informational and please let us know your thoughts in the comments box below. Now let's first understand why we are discussing and what we are discussing. So CPT is convalescent plasma therapy. It's being opted as a potential measure to cure the patients who are suffering from coronavirus. New York Blood Center is going to be the first blood gathering organization in the US who is going to collect the plasma from COVID-19 patients and use it as a possible treatment for the disease. Now there are Spanish healthcare companies as well like Grifols who have teamed up with the US government agencies including the Biomedical Advanced Research Development Authority and Food and Drug Administration to assess the use of plasma therapy for COVID-19. Now what does it do? How does this work? So CPT is a passive antibody therapy which involves the administration of antibodies against a given agent to the individual. So what happens is that in case of active vaccination, it requires the induction of immune response, which is very time consuming and it varies depending on the vaccine recipient. So for one person, if that person has a compromised health system, in that case the vaccine may not work on him properly. For another person who has got a very healthy life and who is very much healthy, for him the vaccine might work very well. So in case of passive antibody administration, it works equally for everyone. In this great crisis where vaccination is taking a lot of time to create, CPT is being said that this is one of the ways that we can combat coronavirus until a permanent vaccine can be created. How it works? So basically in case of CPT, a person who already had coronavirus who has now recovered, they have to give their plasma and that plasma is being collected. That plasma and their blood is already created an immune system and immune response which would help prevent the coronavirus from infecting that person again. So that antibody is also present in that person's blood and that antibody would also work as a protection against the coronavirus for the other people. So for a person who has fully recovered from coronavirus, that antibody can now be collected and it can be used into someone else who have been infected with the virus, and that can trigger an immune response in the person who is infected, and that would possibly help that person's body fight the coronavirus from the inside and destroy it. Now at this point, there has been a lot of time consuming process for creating vaccines, and the number of infected people are rising exponentially day by day. Now CPT is in experimental stage and only on March 24th the US FDA allowed the doctors to use the blood plasma from recovering patients to treat others who need it. And Grifols, a Spanish healthcare agency, has also teamed up with the US government agencies and is trying to collect the plasma from the patients who have recovered and are processing that plasma into a hyperimmune globulin. But this is also a time consuming process, but less time consuming than creating a vaccine, and this can possibly help in mitigating the risk of having a huge number of people infected by the time a vaccine comes out. So this is not something which has been done without any precedent. So previously as well this CPT has been used. Now before antibiotics were created, before there was any vaccine, it was quite common to treat infectious bacterial diseases by infusing the blood of recovered patients into those who have the infection. This approach was previously conducted successfully against viral infections like Ebola, hepatitis E, influenza, H5N1 influenza or bird flu, H1N1 influenza or swine flu, etc. The results were successful in most of the cases, but for many of the cases it was also unsuccessful. But at this moment of crisis where there is a lot of risk to the entire world, it is definitely in the interest of the world to pursue any option which is available, no matter how much success rates might vary. Now, below you will see that there are some examples and some graphs which will show the effective use of CPT. In case of the graphs, you will see that by using CPT, the amount of immune response and the amount of infections has gone down steadily in many of the cases. And there have been a lot of examples where it has been seen that H1N1 infection was also very much treatable with the help of CPT, and it responded well. As coronavirus is also one of the families, that this novel coronavirus is the part of the same family of H1N1 infection, so there's a very high possibility that it will also respond to CPT in the same way. So now, thinking of it in the future, it has not been fully successful yet, but CPT cannot be said as an unsuccessful attempt. It has a significant role. At the moment where there is no other sources like vaccination or proper knowledge, this is an only effective alternative. It's an experimental stage at this point, but it had been earlier conducted in the other cases of infectious diseases, and it did respond. So we can keep our fingers crossed and hope for the best at this point. And we can only try and try and try until we eventually succeed in creating something which would finally rid the world of coronavirus. Now, thank you for staying with us for so long. Please like the video if you found it informational. Please let us know your thoughts in the comment box below, and please share and let others know about it as well. As always, stay safe, stay happy, and see you again at the next video. Thank you.